For breast augmentation alone, whether it's saline implants or silicone implants, there's a risk you're going to be too large, there's a risk you're going to be too small, which is why we go through the whole sizing program. The risk of that happening is very, very small. There is a risk of implant malposition, where the implants end up dropping too much, which can result in something called bottoming out. There is a risk of something called capsular contracture. So your body is going to form a scar capsule around the implant. That happens every single time, whether it's saline or silicone. There's different levels of capsule formation. Level 1 is where the capsule is soft and you don't even know it's there, which is what we want for every result. Level 2 is where the capsule gets a little bit firm. 3 is where it gets firm and it can distort the breast. And 4 is where it gets firm, distorts the breast, and can become painful. Those are generally called capsular contractures. And in severe cases, we have to go back in, take out the capsule, take out the implant, and then replace the implant. It's basically just an over-scarring phenomenon. There's things that we know that can increase the risk of that happening. Over-exercise can do that. Certain low-level infections can do that. But during the surgery, everything is sterile and washed out with antibiotics. So the risk of that happening is low. And also, when you place the implant under the muscle, which is predominantly where your implants get placed, the risk of it happening is very low. It's less than 5%. When you go over the muscle, it's actually pretty high. It's about 30, even 40%. So we generally go under the muscle, but that is a risk. You can have changes or loss of sensation to the breast and or the nipple area. The risk of that happening is about 15%. These aren't nerves you can see. These are nerves that are very small, and they're usually from overstretching of the muscle. It usually comes back, but it doesn't always come back. There's also a risk of asymmetry. We say that no two breasts are ever completely symmetric. They're supposed to be sisters, not twins, but we want them to be sisters, not cousins. In severe cases of asymmetry preoperatively, I sometimes will put a larger implant on the smaller side to correct for it. But unless I'm correcting for it, I don't want to create an asymmetry either. I will use the same size implants. Anytime you do an augmentation, if you have a small asymmetry, it can amplify or augment the asymmetry as well. And then lastly, the risk of scarring, which, as I always say, is 100%. You will have scars. Those are the main risks of breast augmentation.